It is assisting the introduction of a catheter through the bladder in the urethra for the relief of urinary retention or completely emptying the bladder. So, for indwelling catheterization, our equipment will be catheterization tray containing the sterile bowl, sterile gown, sterile gauze pad, as well as the sterile towel with hole, as well as the sterile specimen container, the flushing tray, drainage bag, the syringe with 10 cc's sterile water, and the French catheter in size 12 for young females. Obtain treatment card from the nurse and check with doctor's orders to save time and effort. Bring the equipment to the bedside table. Check lighting source. Next is identify the patient and explain the procedure and need for the patient to keep knees positioned during procedure. Describe pressure sensation that will be felt during catheter insertion. Patient will feel reassured if the procedure is explained and if she is handled gently and considerately. I am your nurse for today, and can I ask what's your name, please?
Grace,
And your age?
13.
Okay. So, during the our procedure for today is catheterization, which is indwelling catheterization, kundi ma-insert ko sa catheter nga sa imo nga urethra nga part, kundi ang ginagawaan sa imo ihi. And then, during the procedure, kinahanglan mo lang i-position kung anong pag-position ta sa tiil mo karon, amo lang na in place lang muna kay para hindi ma-interrupt ang ating nga procedure. And then, during the procedure, madyagang kagid nga slight sensation nga kung diin kung may discomfort and sakit man siya. Pero it is tolerable man. Okay? Okay. Screen the patient to provide privacy. This reduces client embarrassment and aids in relaxation during procedure. Place bed in high position and lower the side rails on working side to promote use of proper body mechanics. Okay, miss, pwede ta i-position atong tail kung diin i-bend na lang sa gamay. Place patient in dorsal recumbent position for female. So this position provides for good visualization of the urinary meatus and perineal structure. Drape the patient with top sheet by assisting the patient to side near you. Loosen the foot part of the top sheet and use diagonal draping and expose the area in the perineum, and this is to avoid unnecessary exposure of body parts and maintain client's comfort. And then provide perineal care if needed to reduce the presence of microorganisms near the urethral meatus. Place tray between thighs facing foot of the bed to provide easy access to supplies during catheter insertion. Adjust drop light by using the flashlight. This permits accurate identification and good view of urethral meatus. Place waste receptacle at an area near you. Wash hands for asepsis. Open the sterile pack by grasping its corners and open it with care, touching only the underneath sides and edges. This provides sterile field and to prevent transmission of microorganisms from table or work area to sterile supplies. Bring edge of cover under buttocks if able. Let doctor open the pack of sterile gloves to put on gloves. This allows the doctor to handle sterile supplies without contamination. Observe sterile technique in offering pack of towel and with hole for draping to maintain sterility. Place an adequate amount of lubricant over the non-dominant hand after the doctor cleanses the urinary meatus. This allows easy insertion of catheter tip through rectal meatus. Instruct client to breathe through the mouth while doctor inserts catheter to the urinary meatus. Relaxation of internal sphincter aids of insertion of catheter. Okay, miss, please breathe through your mouth ha, i-insert na ni Doc ang imo catheter. Okay? Place distal end of catheter in sterile bowl to measure urine volume or attach the drainage bag as indicated. Collection of urine prevents soiling of client's bed, linens, and allows accurate measurement of urinary output. Offer 10 cc of syringe filled with distilled water to the doctor to inflate inflation balloon. Inflation of balloon anchors catheter tip in place. Avoid bladder outlet to prevent removal of catheter. Attach end of catheter to collecting tubes to drainage system unless already connected to bag. Place drainage bag in a dependent position. Close urine drainage is established. Dependent position of drainage bag promotes flow of urine away from the bladder. Tape catheter to the inside of the thigh with strip of non-allergic tape. Allow for slack so that movement of thigh does not create tension on catheter. Anchoring of catheter minimizes trauma to urethra and meatus during client's movement. Catheter positioned over the thigh prevents kinking. Non-allergic tape prevents skin breakdown. Be sure that there are no obstruction or kinks in tubing and place excess coil of tubing on bed and fasten it to bottom sheet with clip from drainage set or with rubber band and safety pin. Patent tubing allows free drainage of urine by gravity and prevent backflow of urine into the bladder. Assist clients to a comfortable position to maintain the client's comfort and security. Instruct client on ways to lie in bed with catheter. Side lying facing drainage system with catheter and tubing drape over lower thigh. Side lying facing away from system, catheter and tubing extending between legs. Urine should drain freely without obstruction. Placing catheter under extremities can result in obstruction as of compression of tubing from client's weight. When client is on one side facing away from the system, catheter should not be placed over upper thigh. This forces urine to drain uphill. Caution the client against pulling on catheter to reduce trauma to urethral meatus. Kag miss lang avoid pulling the catheter ha. Wash hands to reduce the spread of infection. Palpate bladder and ask if client remains uncomfortable to determine if distension is relieved. Okay, miss, mapalpate ko na isang imong bladder, ha? Do you feel any discomfort or uncomfortable ka man? Nagkailaman? Okay. Observe character and amount of urine in drainage system to determine if urine is flowing adequately. Lastly is to record the type and size of catheter inserted, the amount of fluid used to inflate balloon, and the characteristics of urine and the amount of urine. This communicates pertinent information to all members of healthcare team.